In the September 16th issue of JACC, taking a look at angiotensin receptor blocker treatment and its impact on heart failure with preserved ejection fraction and worsening renal function. And I am with Kevin Damman, who is MD, PhD, and Department of Cardiology, University Medical Center in Gronigen in the Netherlands. This is iPreserve analysis data, correct?
Yeah, that's true.
What did you want to look at?
So what we actually know in HFrEF, so patients with reduced ejection fraction, is that in both acute and chronic situations, when there's any deterioration in renal function, you see an increase in mortality and morbidity. So there's an increased risk of doing worse when you have an increase in creatinine. And this also occurs when you're having this on ACE inhibitor or an ARB therapy or an MRI therapy. We're now beginning to realize that not all of these incremental changes in creatinine are a worse outcome, give a worse outcome. We tend to think that when an ACE inhibitor is started, you can accept some increase in creatinine. But for HFpEF it's different because we have no randomized controlled trials that show benefit of any treatment. So what we want to look at in the iPreserve data is to look whether or not there is worsening renal function with an ARB, because it hasn't been reported before. And then we want to look at what the treatment actually does or causes and what the effect would be on mortality.
Now, this is a pretty large group of patients you're analyzing.
Yeah, it's a big group. It's iPreserve, one of the largest HFpEF trials we have at this moment, and also a large follow-up, a long time follow-up. So this means we have a lot of power to investigate these changes in renal function and the relationship with irbesartan treatment in this case.
So how many patients? Describe them a little.
Yeah, so it's about a little less than 4,000 from my head. Excuse me if I got this a bit wrong. And it's about 10% had worsening renal function. So this is comparable to what we see in HFrEF, where we have about 8 to 12% patients on ACE or on ARB therapy who have deterioration of renal function with the initiation of therapy. With MRA therapy, it's a little bit more, it's like 15%. Yeah.
So what's the lesson here?
So what we actually saw is that, and it's the main results of this study, is that we saw that when you have deterioration of renal function with irbesartan, so in 10% of patients, you tend to do worse. While we saw in the HFrEF patient, and even when you have worsening renal function on the initiation of treatment, they still do pretty well. The benefit of ACE or ARB therapy was preserved. And now in iPreserve we see that a therapy that didn't improve outcome, when you have worsening renal function, these patients do even worse. So it's difficult to grasp what's happening here, because you still would expect an ACE or an ARB or angiotensin receptor blocker to have some impact on renal function, but we wouldn't expect this to have a worse outcome related to the treatment. So we do not really know why this happens in these particular patients, but it does mean that once you're treating these patients, perhaps for their hypertension, because not for a mortality benefit, you should really look at the renal function to be sure that it's not deteriorating, to be sure that these patients do well.
Wait 30 days, 6 months?
So we looked at 2 weeks up titration creatinine, and at 8 weeks. So 8 weeks it was the total up titration phase. So the guidelines for HFrEF say you should at least check it after a week and 2 weeks, at least the Europeans say. And once you have a bump in creatinine, you probably should measure it more often, perhaps every 2 weeks. And once it's stable, you can then measure it perhaps every 6 months or even every year. The best lesson here is that once you have this bump in creatinine, you should monitor these patients very carefully.
Yeah, that would be, I think, the recommendation. Yeah. September 16th, JACC is the location for this particular paper as we look at ARB treatment and its impact on HFpEF and worsening renal function. For Cardiol Source World News, I'm Executive Editor Rick McGuire.